A glimmer of hope in India. New COVID-19 cases have dipped below 300,000 for the first time in nearly a month. But experts are warning against celebrating too soon. The World Health Organization says that the numbers are unreliable. Testing remains inadequate in rural areas where the virus is spreading rapidly. At the same time, another threat is on the way. 150,000 people have been evacuated as Cyclone Tauktae makes its way along the west coast. It's the most intense storm in more than 2 decades and is set to hit Gujarat this evening. Neha Punya joins us live now for more. Neha, the cyclone is already making its presence felt in areas that have been battered by the virus.
Absolutely. This is the first cyclone for the year 2021, and it couldn't have come at a worse time. We've seen how the cyclone has already battered India's western coast and impacted regions like Goa, Karnataka, Maharashtra, Kerala and Gujarat. All of these states have, in the last few weeks, struggled to bring their COVID-19 outbreak under control. They've reported a sharp spike in cases as well as deaths, and there has been heavy rainfall in these regions, damage to power lines as well as to roads as well, prompting officials to evacuate thousands of people. They've reported how quarantine centers have also become inundated because of the heavy downpour, and power outages are a problem as well, prompting officials to ensure there's round-the-clock power backup to ensure that healthcare facilities, especially in hospitals, aren't hit. And the other problem, of course, is vaccinations have also been hit. The city of Mumbai suspending its vaccination drive for the day. Gujarat similarly saying it will resume vaccinating its citizens once the threat of the cyclone has passed.
Neha, at the same time, there's been a drop in the national coronavirus caseload, but it doesn't tell the whole picture, does it?
Absolutely. Many are calling this a glimmer at the end of a long, dark, devastating tunnel. We have seen India's daily caseload drop under the 300,000 mark for the first time in over a month. This dip in cases being led largely by regions like Delhi and Maharashtra, which have now imposed lockdowns for 4 weeks and counting. And experts say while this is helping, flatten the curve in urban India, it's not the entire picture, because testing in India is still hugely inadequate. The WHO also pointing to this to say that while we are seeing some testing, at least in urban areas, in rural India, where the virus is now spreading, it's nearly impossible to get tested. Many families, especially in states like Uttar Pradesh, which have seen a huge spike in cases in villages and smaller towns, are saying that their family members have died because of a fever and a cough, because they simply couldn't even get tested for coronavirus. We've seen how bodies continue to wash up along the shores of the river Ganges in Uttar Pradesh and Bihar. Thousands of bodies found buried in the sand close to the river as well, prompting officials to ask locals not to dump the bodies in the river, to cremate them properly. The state of Uttar Pradesh saying it will give them funds. But the problem is, locals say that these are potentially COVID-19 patients. It speaks of how stretched resources are, and also how the virus is already devastating India's most vulnerable regions.
Neha, thank you for that update. Neha Punya there in New Delhi.